So, knowing that you practice integrative medicine, we went ahead and reached out to our fellow students, our peers, our faculty, and especially those who are interested in the field, and just got a feel for what they were curious about. If they had a chance to ask you. So, first off, tell us about your job. Did you always know that you wanted to do holistic medicine, or how did you really discover your passion for holistic medicine?
Well, leading up to today, I feel like my veterinary clinical practice career has always been in a bit of an evolution. Just going through school, I really was attracted to radiology. I planned on becoming a radiologist. During my internship, I applied for radiology residencies, but was not accepted into them. So I needed to figure out another path, and the path was potentially going to be to reapply for radiology residencies, but I started questioning, was that really what I wanted to do? Or could I be happy doing general practice, emergency practice, or something else? And that's when I really was very much involved in yoga practice, yoga teaching, and I started learning things about my body and exploring different ways of trying to manage certain chronic conditions that I have related to pain, and that created an exposure to acupuncture, chiropractic, physical therapy, and all those things that I use currently to try to keep myself healthy. And then I figured I can just start applying this to my patients. And I could just label myself as somebody who does that and not do the training, but I felt it was appropriate that I get the certification and things like that. So I went through my veterinary acupuncture training, which taught me about Chinese medicine, food, energy, and it really lets you have a different perspective to what you know from your Western veterinary practice, like how to manage a Western disease from a Chinese medicine perspective. And from there, I started recognizing the things that I understood the best, like arthritis and cancer and diseases like that. And there's a lot to those diseases that I, of course, don't understand too, but I try to best apply my knowledge to those things in my practice. And so my current clinical practice is a house call-based practice primarily, because that's really where acupuncture works best. When pets are in the comfort of their own home, they're not stressed out by being in a veterinary facility. They don't have to travel to get there. They're not going to be exposed to illnesses or trauma in that process. So that's why I like doing that on a house call basis. I love working with my clients. I have very, very good clients that utilize me appropriately for all the things that I can do for them. And certainly I try to cater to a clientele that's a higher end clientele. I'll help anybody, but certainly there has to be some kind of exchange. And so it's nice being in Los Angeles to have clients that can afford the type of high-end, almost concierge-style veterinary practice that I offer. And then within the Veterinary Cancer Group, I really try to offer a holistic complement to traditional oncology from a perspective of medical oncology or radiation. Because as these patients are really sick and are maybe even getting sicker because of their treatments, they really need to be supported in terms of food and nutraceuticals. So I really focus on that primarily there, and it's been a great combination from a clinical practice perspective for me. And also it gives me some control over my schedule. I make my own schedule. I decide what I want to do and what I don't want to do. I'm not obligated to see every single person that calls me, because sometimes when you work in a veterinary practice, you see whoever comes in the door pretty much. And if you don't, there's often retribution, either from a perspective of PR for the practice or for yourself or financially. But working for yourself, you make all the own rules and you take on what you feel is appropriate. I don't take on things that I don't think I can really help with for the most part. But I'll still talk to somebody and try to help them and get them to the place where they can get help beyond what I can provide.
Awesome. So, speaking about your clients and working with them on a holistic medicine basis, it seems like they really come to you for your specific set of skills. And so, how do you really educate your clients about holistic medicine? How do you describe it or define it to them?
Sure. Well, I always consider holistic medicine, if it's veterinary or human, it's not just tree hugging and drinking tea made out of twigs and wearing Birkenstocks and patchouli and things like that. It's really, holism is just really looking at the entire organism. So when you have a pet that comes in that has an ear infection, besides just trying to manage the ear infection through cleaning and medication, why is it happening in the first place? Is there underlying inflammation of the skin because of environmental allergies, which could be seasonal or non-seasonal? Is there a food component? Is there an underlying medical condition that's making them more susceptible to immune system compromise that leads to allergies or infections in the first place? So it's really looking at the entire animal and trying to find out everything that's wrong with them to the most point and really manage all those at once. Like, so often when I see a pet, maybe they have some pain because of arthritis, but they also have very advanced periodontal disease, and that needs to be managed too because of the mouth bacteria getting to the blood and adversely affecting the immune system. Or they have arthritis and they need pain management, but they're 10 pounds overweight and they're a dog and they're middle-aged. Maybe they're hypothyroid. We have to try to figure out the issue and get that managed. So we really need to take the time and be willing to do the research and really educate clients as to it's extremely important that you invest time and often money into making sure your pet is as healthy as possible throughout their life instead of waiting until a problem is so bad that the pet obviously seems like they're suffering. You don't want to wait until periodontal disease is so bad that your pet's breath knocks you out. You don't want to wait until they're so fat that they can't get up and down the stairs or they rupture a cruciate ligament just trying to run or play. So it's really important that through all life stages you focus on maintaining your pet as healthy as possible.
Great. So in terms of integrating holistic medicine with traditional Western medicine, could you talk about how you really meld those two together? And is there ever a conflict between one modality that works better, or how do you go about taking the two schools of thought and really integrating that into great quality care for each patient?
That's a really good question because when I was going through each school, either the traditional Western training where I really wasn't aware of what was available from a non-traditional perspective, or going through the Chinese medicine training, I was thinking, am I going to just be doing one or the other? But I really think every case that I treat gets that integration of Western and Chinese medicine. Even from a physical exam perspective, I'm still looking in the eyes and the ears, the nose and the throat, listening to heart and lungs, palpating abdomens, doing rectal exams, taking all joints through range of motion. But then in Chinese medicine, you're looking closely at tongue and you're feeling pulses and giving very specific evaluations of each of them, which helps to create a Chinese medicine diagnosis. And the main practice that I do is trying to do multimodal pain management, which is reducing reliance on medications that have side effects. For example, our non-steroidal anti-inflammatories for arthritis work, but we don't want to rely solely on them. We want to make our pets need less of them by getting them to lose weight, by improving the range of motion and the comfort of their joints with acupuncture or physical therapy. We want to figure out what's going on underlying that could be contributing to the condition in the first place. So every patient that I see gets that integration, and actually the application of it has been pretty seamless, and I notice that so many of my pets' patients, that is, benefit from, say, nutraceutical enhancement to try to make them need less pain medication, healthy human-grade foods to try to reduce the amount of problems that they're having as a result of eating their pet-grade foods, trying to think about, should we vaccinate a pet if we get that card in the mail? How about doing a blood test to see if the pet even needs it in the first place? So really looking at managing illnesses from those perspectives has been great, and using the two of them together hasn't been as much of a challenge as I thought it would be.